WisconsinEye's Campaign 2024 programming is sponsored by Wisconsin Counties Association, Nicolet National Bank, Wisconsin Hospital Association, Operating Engineers Local 139, the Wisconsin Realtors Association, the Wisconsin Laborers District Council, and North Central State's Regional Council of Carpenters. To support programs like this, please consider a tax-deductible donation at wiseye.org/donate or by texting WisCI to 44321.
Representative Clint Moses of Menomonie is the Republican candidate in the 92nd Assembly District. The election is November 5th. Representative Moses, welcome to WisconsinEye.
Yeah, thank you for having me. It's great to be here.
Sure. I'll start out by asking you, what's your campaign's key message? Why are you running for re-election to the Assembly?
You know, I've got a history of public service. You know, I served on our local school board. I was the chair of our community foundation. I was a president of our Rotary Club. I am a chiropractor. I chose my profession because it serves people and helps people, and that's the same reason I'm in the legislature. And you know, a lot of times, especially right now, campaigns have like 3 bullet points or kind of taglines that they're using. I'm very broad. As far as if a person comes to me with a problem, I want to do my best to try and help it and not get wrapped up in the political part of the campaign season right now.
So if you're elected, what's an example of a bill that would be a priority for you to introduce?
Oh, you're going to make me pick one. That is very, very difficult. One of the ones that I worked on and actually got signed by the governor last session, I'd like to expand on that, the Regional Mental Health Crisis Center. So primarily, I would like to get a bill out there more targeted towards our youth and our children. And I know we'll probably get to that later in this discussion as well, but looking at more to prevent some of these issues before they occur.
So as you know, you'd be entering the Assembly during a biennial budget year. The state's now projected to have, I think I saw yesterday, more than a $4 billion surplus. What would be the top 2 priorities for use of surplus funding?
It has gone up, and I'm glad you asked that question as well. Obviously, that money's there because we overtaxed our citizens. So I think, first of all, the vast majority of it should go back to those that paid it. I think it's a great time to look at tax reform, although it's challenging in a divided government like we have in Wisconsin. But I think it's a great time to look at tax reform, and then also maybe one-time usage for infrastructure. Maybe look at something like infrastructure grants where people can apply for it. Where, you know, in my district, there's a couple of issues with some bridges that could use some updated and stuff. And it's just too much for our local county government to fund all by themselves. Obviously, they get some help from the feds too, but look at maybe one-time use, because I'd be very cautionary to set us up for something where we fund it at one level, and then if we have hard times down the road, to try and sustain that funding.
What kind of tax cuts or tax reform is a priority for you?
I'd like to see, obviously, income tax cuts to some extent. Property tax is a huge one that I see, especially with my people on fixed incomes, my seniors that are in their homes. They maybe even have them paid off, but when they see their property tax bills go up and up and up, they're talking to me about, geez, I don't know if I can stay in my home. I might have to move into an apartment, especially when you start talking about some of the referendums that are out there and levy limits and all these other issues. So I'd like to look at those tax reforms. I'd be more apt to maybe a possible sales tax reform where we increase it. That's probably the only one I'd look at increasing because it's more of a consumer tax.
K-12 education is a priority for many voters. What is your priority within K-12 public education?
And here's another, you know, obviously as a former school board member, I served on our Menomonie School District Board for a while, so I saw firsthand. I was down in the trenches, so to speak, as a local school board member. You know, our district, I think, was very fiscally responsible, but we still ended up with shorts in the budget, especially after the COVID money disappeared, essentially. So I'd like to look at basically restructuring how the school funding formula occurs. And there's others, Democrats and Republicans, that I think would be favorable to looking at what are we doing here. But that is a huge reform. That is something that we would have to do a complete overhaul on. I don't like the fact that there are so many districts in the state that are having to go to referendum. My district, for instance, was one of the ones that failed this spring. It was an operational referendum, which people didn't like because it was going to pay utilities and kind of not things that are necessarily always sexy, not fun for the taxpayers. And it was a recurring referendum, which meant once they agreed to it, it would continue forever and ever.
What about higher education, the state's system of four-year colleges, two-year colleges, technical colleges? What does the future of that system look like to you, and where do you think the legislature should focus?
Yeah, and it's a priority for me. Obviously, I'm a UW Stout alumni, one of only a couple in the Capitol, actually. Proud to be an alumni of that institution. You know, we need to look at the changing demographics in our state. Obviously, the student enrollment numbers in our high schools, in our K-12, and also in our college and universities is declining. You know, there's not as many kids being born in Wisconsin. I do have a daughter that's at UW River Falls, having a great time over there for veterinary science. But that's really the key, is especially in our region up here in western Wisconsin. I know some of my colleagues will say maybe we need to look at consolidation or something like that. But each of them serves a specific mission. And I'll go back to this last session. I was proud to write a budget request for UW Stout for their Heritage Hall building. Heritage Hall is going to actually serve 3 times more students than the current building they're replacing without expanding the footprint. So they are not expanding their actually brick and mortar on campus, but they're using it more efficiently. They're updating what they've got, and it's for their primarily hotel restaurant management, interior design. They even have golf management, which is a degree, and it's a great one at UW Stout. They also have real estate in that building. So it's not necessarily expanding, you know, the footprint of it. The other thing we really need to look at with our higher education institutions is the return on investment. Are they producing the students that our workforce needs in Wisconsin? And are these students going to stay in our state and work?
Do you support an increase in funding for the University of Wisconsin system overall then?
Well, I did in this case for UW Stout for that building project. You know, as far as increasing spending money across the board, I'd have to definitely look at what it's going to be used for. We need a little bit more transparency as to where that money is going. You know, that was the big talk, especially with the diversity, equity, and inclusion. And I'll bring it up. You didn't bring it up. But the DEI, you know, myself and I would argue with the vast, vast majority of my colleagues don't have a problem with DEI if it's putting people out there in the workforce that can work with others. The problem is when we audited the number of DEI positions in the state and saw the amount of money that was being spent on higher level administration for that particular program, that's a problem. How is that helping our students prepare for the workforce if we're putting all of that money into programs like that? So, you know, I just return on investment and looking at where that money is going. I'm not going to say I'd oppose, you know, funding, but I'm also not going to say that I'm going to open up the checkbook and let them write a blank check.
What do you see as the state's largest workforce development challenge, and how would you address it?
And there again, the number one I would say is demographics. You know, we have an aging population, people that are retiring, and we just don't have the people to replace those. So as a state, we need to look at what we can do to not only keep our talent in state, but also attract others from out of state. You know, I live on almost the west coast of Wisconsin, near the Minnesota border, and we do have a number of people coming across from Minnesota and taking jobs in Wisconsin. And we need to continue to make sure that Wisconsin is an attractive place to not only work but raise your family and grow.
What is the proposal that does that?
No, there's reciprocity out there, and that would be I would fully support that.
Investments in public and energy infrastructure grow our state's economy. This also provides an opportunity to invest in our state's workforce, but currently there are no requirements for hiring local workers. Would you support a state resident hiring requirement for state, local, and utility scale infrastructure investments?
As far as a requirement, I would not support it because I think it really hamstrings us. It really limits us and could drive the costs up on some of these projects. However, I'll tell you, just like I do in my own business and my own business dealings, I try to prioritize local business because nothing makes you feel better than when you're supporting maybe your neighbors, your friends, your colleagues that are right in your own community and in your own state. So obviously I'd be all in favor of incentivizing hiring a Wisconsin workforce. But when you start talking about some of these larger scale, like perhaps an industrial energy project or a major road project, we have to bring in people that are going to be able to get the job done timely and also cost effective. So I think it needs to be open to kind of a free market open bid system, but I would definitely give priority to our Wisconsin residents on that.
Employee classification is an issue in the construction industry. Some employers misclassify workers as independent contractors or pay them in cash off the books. This lowers costs by avoiding payroll taxes and unemployment insurance, and it puts compliant companies at a disadvantage when bidding on projects. Plus, misclassified workers may be denied minimum wage protections or overtime pay. Are you aware of this issue, and what do you think should be done?
I am. I'll tell you, I don't necessarily hear it a lot on doors, when I'm talking to people right now, like over the last few months. But I will tell you, it's not just unique to the construction industry. Obviously, I come from the healthcare industry, and we see that in our industry with like massage therapists and outside workers that might come in. I think we need to really look at what the laws are that are already in place and enforcement of them. Because it's not fair to me if I'm playing by the rules, paying my withholding taxes and paying basically my Social Security for my employees that work for me, and someone else is skirting by and not paying those. Because obviously my overhead, my expense by doing it correctly is going to be higher than theirs. And it also, the person that's doing that, the employee that's basically taking cash on the side or working as an independent contractor, they need to look at their future too, as far as what does that do to them 10, 20, maybe 30 years down the road when they go to retire and they don't have Social Security. They don't have a retirement plan because all this time they've been basically just pocketing cash. So my shorter answer on that is we really just need to look at the enforcement that's out there. And I do know that it's a small problem. It's not one that people bring up at the doors, but it's definitely something we need to work on.
Affordable rental housing is an issue in Wisconsin, and some support government-imposed rent control to maintain affordability, while others argue keeping rent artificially low will decrease rental supply, resulting in increased prices. What is your sense of housing as an issue, and which better addresses rental housing affordability? Is it rent control, building more rentals, or some other solution?
Boy, we could have a long discussion on this one, too. You look at states and municipalities, cities where they've put rent control in place, and quite frankly, it just hasn't worked. It's actually, if you look at historically, it's made the situation worse. So I would not support rent control, but I would do everything I can to make it more attractive for builders to come into our communities and build. And that might look at, you might look at something like zoning, what type of infrastructure is required, how big the lot size is, those types of things. My mayor in Menomonie, he's a big proponent of the tiny houses. So I've learned quite a bit about that because he's really in favor of that. Chippewa Falls, for instance, a new part of my district, they have a small tiny home community. We need to look at thinking outside the box and not continue to put more regulation on our builders, obviously making sure that our housing is safe, but making sure, is it really necessary? Is all the red tape necessary? We need to attract more builders in. In the last session, we had a housing package. One of them looked at, there was actually 4 different bills, I believe. One of them looked at revitalizing downtown areas. I mean, I've got a couple downtowns. If you look around the state, there are many downtowns where the second level, above like a retail setting or possibly a bar in Wisconsin, it's vacant. It's not being utilized. Those areas are prime, especially in a college town like I have. If you fix those up, students and even young families would love to live there because it's convenient walking distance to everything. The other one of the bills looked at repurposing the big box stores that have closed up when they've gone to more online marketing, online merchant services. We could utilize some of those. There's areas like I drive through, and I'm name dropping all kinds of communities, but Wisconsin Rapids is a prime example. You've got a lot of vacant buildings there. Even in Menomonie, where I am, there's a lot of vacant areas that could be utilized rather than urban sprawl and adding out into our farm fields as well.
I want to transition you to healthcare. Medical systems are facing numerous headwinds in the form of inflation, workforce development, and issues around Medicare and Medicaid reimbursement, resulting in fewer services and even the closure of a hospital system here in western Wisconsin. What would you do to preserve access to care and prevent future closures?
Yeah, and thanks. And this is one that I could take my whole interview. Obviously, I chair the Health, Aging, Long-Term Care Committee for the Assembly. Worked in healthcare my entire career. So I know I've been out there, I've been treating patients, I've been dealing with insurance companies, dealing with reimbursement rates. I do take Medicaid and Medicare, so I know what that is as a provider. I'll start with what I did do. We had the announcement that HSHS here in the Chippewa Valley was going to close St. Joseph's and also Sacred Heart here in Eau Claire. We had that notice just slightly over a month prior to the end of session, basically. We scrambled very quickly, repurposed $15 million that was originally allocated from the prior budget to mental health beds at Sacred Heart here in Eau Claire. We got that bill passed through the Assembly, through the Senate very quickly with some of my friends in the Senate and obviously colleagues from throughout the Chippewa Valley. That got to the governor's desk. He signed the fiscal part of it, partially vetoed the intent of the bill, basically expanding its scope as far as taking it beyond critical care emergency room services and taking it outside the Chippewa Valley possibly, so not just Chippewa and Eau Claire County. So I was proud to actually get that passed and somewhat across the finish line. I am urging my colleagues on Joint Committee on Finance, as soon as someone comes up with a viable plan to release the money. So far, we've had a number of, I hate to say behind the scenes, people interested, people coming forward that would like to help with the situation, but nothing has actually materialized on that.
Is that a priority for you?
Oh, big time, for sure. You know, I felt very rushed at the end. I was, like I said, glad to get something done. I will say that we did increase this last session, DISH, which is basically the increase for rural critical access hospitals.
And you support that again?
And I would support it again. I also supported increase in Medicaid reimbursements for providers the last two sessions. I was actually lead author on that budget request. So the problem is, even though we increased it, it didn't keep up with the inflation. I'll be completely honest. My costs, and I know it from my own small clinic, you know, my costs keep going up and up and up. And Medicaid, if I have too many people on that are at a low reimbursement rate, I can't afford to pay my overhead, my staff, and even myself at the end of the day. So that is the challenge that these hospitals were looking at. In both cases, they were between 65 and 70% Medicaid, Medicare reimbursement. Well,
I want to talk a little bit about mental health. What are you hearing on mental health in the district, and what are some solutions you support?
Yeah, thank you. And that's one that we hear a lot on doors, and that was really my prize, my capstone project for this session, essentially. I actually got a bill across that received unanimous support. We had it was a 97-0 vote in the Assembly, and it passed unanimously in the Senate, and it was signed by the governor. It is the Crisis Now Urgent Care model, which is for people that are going into either a mental health crisis or a drug and alcohol crisis, basically. Currently, those people are being transported to Winnebago Institute, which from where we're sitting right here, that's at least about 5 hours one way. So think of a person in mental health crisis, detaining them, putting them in the back of a squad car and transporting them 5 hours across the state, because that's a facility we have for them. And then what it does to local government, the cost. For our law enforcement that has to take a deputy, or usually two actually, across the state, takes them out of commission in our community for basically one full shift.
Is there a need for more investment then in that model?
Yeah, there is. In this, I view that bill as really a good starting point. You know, that was basically to set up one with priority in western Wisconsin. I hope it's up here in the Chippewa Valley and not the southwest part of the state, but we are still working on that. That bill basically is still in DHS for rules right now. I've got a number of interested stakeholders. There's a coalition of about 7 or 8 counties up here that would like to apply for that.
How should Wisconsin move forward on the issue of abortion?
Yeah, we've been getting this one a lot at the door too, and this is the main reason I came here today, to try and help set the record straight on this, because this is one of the things that's definitely being used very much politically. Once again, as chair of the Health, Aging, Long-Term Care Committee, I actually had the public hearing on the bill that we had this past session that would have put abortion up to a public referendum. It was not a fun public hearing. We had opposition on both sides. We had people that were very, very much pro-choice and very much pro-life. So it was not a fun meeting to run, I'll be honest with that. And quite frankly, if I could do it my way, I would like to see a referendum that was more of a multiple choice. We basically came up with a compromise, tried to start a discussion. Okay, myself, I am completely pro-life. My wife and I have never had to make that difficult decision. Myself as a male, I would never have to make that decision.
Do you personally support a number of weeks?
I do, but I think we need to have a discussion on that. And honestly, as a representative to the people, this is such an important issue that I really do think it should go back to the people. And that's why, like I said before, I think it should be kind of a multiple choice type referendum, if we could ever do such a thing.
Around the
and it has to be up or down. But yeah, to have that discussion. The problem is people get so heated on this issue, and it is such an emotional issue that it is hard to have a sit-down conversation. But like I said, when I ran the first time, I was all about informed consent and choosing what you do with your body. So for this thing to come up, it's very difficult this campaign season, I'll be honest.
I want to move you to transportation. What are the pressing transportation needs in your district, and how important is it that these needs are addressed, and for the state to keep on schedule with reconstruction of aging interstates and significant corridors of commerce?
Yep, and every district you probably hear about the same thing. We might have unique projects. Like I've got a couple intersections. One is very near to my farm, where I actually have the DOT, after numerous complaints, I had actually written a letter to support doing a study. So they're doing a study because there was 3 fatalities actually within the period of about a 12 to 18 month period, right on Highway 25, just north of Menomonie there. We're looking at options like, do we slow traffic? Do we expand lanes? Do we put in a roundabout like they have in a lot of surrounding counties in that area? But then also, I think, once again, this is a good place for us to use some of our surplus. Maybe we put out infrastructure grants so that people can look at, our local municipalities can look at, okay, I've got this big project that I just can't take on. The state could help out with that.
What about PFAS and water contaminants? Is that an issue that's important to you, and how would you propose to address it?
It is, and I supported the $125 million that was used for PFAS cleanup. I would like a little more guidance from the federal government as far as what the safe levels are, because it seems like a moving target. But obviously we want clean water, we want clean air. I mean, I live out in the country, I do a little bit of farming. I want that stuff to be there for my kids too, and I want safe drinking water.
We're down to our final 2 questions. What's the leading difference between you and your opponent?
Oh, huge. I think that probably the biggest, if I had to sum it up, because I know we're limited on time here, but perspective and looking at the past versus looking at the future. My opponent, a lot of times, I've heard him speak a number of times, he's all focused on the past and the gerrymandered maps and the unfair rigged system and this and that. And Republicans and Democrats don't work together, they don't eat dinner together, they don't talk. I'm here to tell you, I do eat once in a while, and I have breakfast and dinner with some of my Democrat colleagues. In fact, one of the first things that I did when I was appointed as chair of the Health Committee, first people I called was the Democrats on my committee, and I wanted to set up a meeting one-on-one to actually get to know them and what's important to them. Because our government does work inside the building more than people think on the outside. My opponent, like a lot of people, his perception is based on what the media tells you. The media typically, and I'm not talking about you guys, is not going to tell you, yeah, they're actually working on this together. It's not as newsworthy versus showing a fight on the floor or a heavy debate on the floor. So that's probably the primary difference. I am focused on looking towards the future, and I'm positive. I'm really optimistic about the outlook for people in Wisconsin. I think it's a great state. If I didn't think so, I wouldn't have moved back here,
Final question for you. Let's say you get elected this fall and you get a magic wand you can use in the state capitol to resolve one issue in a way that brings all people together. What is that issue?
Well, the first thing I do is I get out my fairy dust and I'd sprinkle it over the Capitol, and that would be to get a reset. Because after a very contentious, hard-fought election season, I would like everyone just to reset, take a deep breath, calm down, and roll up our sleeves and get to work. Because it gets so unbelievably partisan, and I'm going to be honest, personally nasty doing campaign season. So I'd like to see a reset with my colleagues on both sides of the aisle. And then, if I could wave a wand, I'd like to do an omnibus bill, which is not popular in state government, that would make Wisconsin the most healthy state in the nation.
All right. Thank you, Representative Clint Moses of Menomonie, the Republican candidate for the 92nd Assembly District. The election is November 5th. Representative Clint Moses, thank you for talking with WisconsinEye.
Thank you very much.
This programming is brought to you by our generous sponsors. Thank you for watching.